Good afternoon and welcome to the Tuesday edition of Video Clips. And the first thing I want to do is make an announcement about a workshop we have coming up on Monday, October 22nd, featuring one of our favorites, Chef AJ from California. And the topic is eating a plant-based diet and having trouble losing weight. And I would guess that some of the people watching this right now might answer yes to that question. So here's Chef AJ's story. She converted to what was a pretty perfect, as she thought it was, plant-based diet. Still carried about 25 extra pounds, and no matter what she did, couldn't seem to lose the weight. And then she started realizing little things make a big difference, made some changes in her diet. The weight came off. In fact, she posted some things on the internet with before and after pictures, and they were pretty striking, you know, her in her new, thinner form. And when I picked her up at the airport when she came to Columbus back in June, I mean, I couldn't believe the difference because I had just seen her back in November, and here she was, a whole new Chef AJ. Anyway, this whole thing is been stimulating a lot of internet controversy, if you will. And so you might want to just call in and see what all the fuss is about. So to get information on participating in that call, which is on Monday, October 22nd at 9 p.m., just call our office and get the passcode and call-in number. And the other thing I'm reminding everybody, November 2nd through 4th is our conference, and Dr. John McDougall will be in Columbus to talk about the starch solution. I read this book as soon as I got it. It's fabulous. I think everything John McDougall does is fabulous. And he's just one of many speakers that will be with us for the weekend that I think you're going to want to hear from. So this week we're wrapping up this series on Robert Whittaker's book, Anatomy of an Epidemic. And I've been spending a lot of time on this issue because I've really gotten so angry about it. I feel like I just need to tell the world about it. But when drugs were first introduced to treat mental illness, psychiatrists were very excited. And I've talked about this before in the series and in other things that I've written and spoken about, that psychiatrists really wanted to be like real doctors where they do diagnoses and prescribe drugs. And so this sort of fit into what they were looking for. But from the very beginning, there were challenges. Dr. Tom Saz wrote a book called The Myth of Mental Illness, which I've read, by the way. It's phenomenal. And this was back in 1961, and he was questioning the profession and saying that psychiatrists really had more in common with police and ministers than doctors, and he really questioned the model of this biological model of mental illness. And so that was a nagging problem. And then the psychiatry profession had to deal with competition from psychologists and counselors. And by 1975, there were more non-psychiatrists in the helping professions than there were psychiatrists. And some of them were talking about the death of psychiatry was coming due to the competition. But the real problem that the psychiatry profession has always had is that the drugs don't work. Because if they did, the competition wouldn't matter, and Tom Saz's book would have gone away a long time ago. But the problem is the biological theory of mental illness and the drugs to treat it it doesn't work. The perception of patients and the public was also an issue. The drugs were so objectionable to patients that in the mental institutions, it was a common practice to do what they call tonguing, which you would take the drug but not swallow it. So in response to this, you've got to give these drug companies credit for ingenuity. They developed liquid and injectable versions of the drugs so that the patients had to take them. And then, of course, the discovery that the Soviets were torturing dissidents with neuroleptics because they induced such physical discomfort that people would recant their stance against communism. This is a true story. This was actually going on. Rather than be forced to take the drugs, I mean, these drugs were being used as punishment for political prisoners, for crying out loud. Well, the psychiatric profession just dug their heels in more, and an all-out effort was mounted to medicalize psychiatry based on the medical model, which is to perform an exam and prescribe drugs. The Diagnostic and Statistical Manual 3 identified 254 quote-unquote diseases that could be treated with drugs, and nobody seemed to mind that when this book came out, there were no new scientific discoveries showing that there was anything going on biologically or that the drugs addressed those things. But the psychiatry profession had latched on to a process that we're all very familiar with called disease mongering. It's used by other specialties too, and this is where you take basically healthy people and turn them into patients by broadening the diagnostic criteria to the place where everybody qualifies. And you know, I probably qualify for some of these 254 conditions, like grieving for a lost relative on any given day too. So And they adopted another very effective strategy, which was to discredit anyone who threatened their business. So, for example, one researcher tried to do a study in which schizophrenic patients living in an ordinary home and treated by non-professionals were compared to schizophrenic patients who were given drugs. Pressure from the profession resulted in his funding being eliminated. The researcher lost his job at the National Institute of Mental Health, and the message was clear. Psychiatrists who didn't get behind the medical model and the biological model of mental illness would pay. The American Psychiatric Association then launched an all-out PR campaign to the public to make sure that everybody knew that psychiatrists have been very busy behind the scenes working to learn how to treat diseases that now affected, they said, 20% of the population. The drug companies soon saw opportunities to fund research for psychiatrists, just like they did for other diseases, to involve them in continuing medical education programs and to hire them as speakers and spokespersons. Those who dared mention that there might be something wrong with the theory were not invited back, and with $2,000 to $10,000 per talk being paid, the incentive to be quiet was pretty strong. These speakers became known as the thought leaders of psychiatry and wrote the textbooks that were used in medical schools, a way to perpetuate the whole system. The icing on the cake was when Shervert Fraser was appointed to head the National Institute of Mental Health, and he launched a quote-unquote education campaign called the Depression Awareness, Recognition, and Treatment Program to tell the public that depression was common, it was serious, it was treatable, and he got the drug companies to contribute resources to the project. The National Institute of Mental Health simply lied and reported that the broken brain theory of psychiatry was true. And interestingly enough, a consumer group provided a lot of help to perpetuate all the mythology around psychiatry. The National Alliance for the Medically Ill wanted mental illness to be recognized as a biological illness with the same benefits afforded to other biological illnesses. Chapters formed all over the country, and psychiatrists were encouraged to become part of them. The fix was in. Money and influence had overridden science and drug treatment. And drug treatment was now the standard of care. So obviously for psychiatric drugs to become so popular, something had to go terribly wrong in terms of regulation, and that's what we'll be talking about on Thursday's edition of News Clips, and we will finish this series up on Thursday. So thanks for listening. As always, pass this on to anybody who you think would benefit from listening to it.